Welcome to our Southern Health podcast, Conversations with Perinatal Psychology. We're here celebrating Maternal Mental Health Week this week, and we're talking about maternal mental health matters because maternal mental health is important not just for the mum, but for the children as well. So maternal mental health matters both for you and your children. And today's topic is talking about positivity. So I'm Dr. Hannah Wilson. I'm a consultant clinical psychologist with the perinatal team, and I've invited two people today to have a conversation about the topic of positivity because they've brought so much positive energy to the team since they've joined us. And so I see them as experts on positivity. So I would like to introduce to you Candice and Hayley. So Candice, would you just introduce yourself and tell us a little bit about your role with the perinatal mental health team?
Thank you, Hannah. My name's Candice Prevett. I'm a peer support worker in the community mental health team. I joined the team 2 years ago, along with Hayley, a brand new role to the team, a brand new role to me, bringing my lived experience of a perinatal journey with my 3 children, and bringing that experience to what I hope is to support mums and their families in their journey with our team.
Thank you, Candice. And we also have Hayley. Hayley, do you want to just quickly introduce yourself and your role in the team?
Yeah, thanks, Hannah. Hello, I'm Hayley Middleton. I'm also the other peer support worker alongside Candice, as she's already said. There's just the two of us that work in the team. We started 2 years ago and have developed the role from nothing, which we are very proud about. Like Candice, I have my own lived experience, albeit a very different one, as is everybody's. And we are here to help others along their journey, be hopeful for them that things will be okay.
Thank you, Hayley. Thank you, Candice. So we've decided on this topic of positivity. I mean, in psychology, we know that how we think influences our mood. And equally, the current mood state we're in will influence how we're thinking. And because of this, a lot of psychologists, and there has been very, I think they're well-known books on the power of positive thinking. And it's a really interesting topic because of this. And it got me thinking about having a conversation about what it means. So I'd like to ask that question to both of you. What does positivity mean to you?
Okay, shall I kick off?
Go for it, Candice.
I've thought about it quite a lot since you posed the question to us, and for me, I don't think it's a thing that comes on its own. Being positive and positivity, I think for me, it's not necessarily about kind of seeing the world perhaps through rose-tinted glasses, that everything is okay and everything's amazing. It's perhaps more about thinking that in the end everything is going to be okay. And I think that's different. And I think it comes alongside other things such as hope and acceptance of some situations, and kind of an understanding that there are challenges in life, and things can be really tough and they can be really hard, but you can learn and grow from those things and come out of the other side of them. And I think also that it kind of comes, for me, definitely, over a 10-year period. I think positivity came from a massive period of growth and change, and that's where there was a big shift for me. I think I've got 3 boys, and I think having postnatal depression and anxiety with all 3 of them, the journeys through my recoveries with the three of them were very different. And I think the key difference was with the first two, there was this longing, this desire for things to get back to how they were. Whereas with the third episode, it was more of a realization, I think, that things were different, because I don't think you can go through an experience like that and come out the other side without being different, but actually that I'd come away with some amazing strength and courage, and there'd been a lot of bravery, and actually there were some positive things that came out of that, because I'm a very different person now, and I can reflect back now. I'm such a long way down my recovery journey that actually, I think I'm a better person than before all of this happened.
It's kind of like you would want to go back now. Yeah.
No, I really don't think I would. I bizarrely think I would probably go through all of that again if it meant I got to this point, if that makes sense.
That's interesting, isn't it? That the positivity isn't just one, it doesn't just happen. You can't just go, right, I'm going to be positive today. It doesn't happen like that. And also that it doesn't have to be on the first glance, a positive experience for positivity and growth and development to come from it.
No, because it's definitely not been a fluffy, pretty journey. It's been really knobbly and really ugly in places. But I quite often now think of, what has poor mental health done for me? And actually, when I think about it now, it's done quite a lot. And that for me is where the positive bit comes from.
I often
because
say
of what
to
I've
people,
learned from those experiences.
That like post-traumatic growth, it doesn't just have to be distress. There can be growth and learning that come from adverse experiences. And it reminds me of that phrase, Candice, you can't make an omelette without breaking some eggs.
No.
or the cracks are what let the light in. So sometimes things have got to crack up, haven't they, and break down for us to see what is positive, to see what lights that can bring in. Yeah. Hayley, what about you? What does positivity mean for you?
I've also been thinking about this quite a bit. Positivity to me actually has been for a massive chunk of my life quite a negative thing. I have personally been subjected for, as I say, a massive chunk of my life to people that are over positive and try and inflict that on me.
Yeah.
So I've seen it as quite a negative thing. Like if I'm not that positive, then I can't be positive.
So it's almost been like a stick people have beaten you with, or if only you were more positive, just think positively.
So it's quite initially for me, the word positive makes me feel even more negative. However, if I drill down more and think about it, as I have come so far on my recovery journey from recovering from lots of various things, really, I do try and find the positive in situations now, but I think that being positive is unique to the individual and it looks different for everybody. It's not just a blanket, are you positive, negative, and it's very, very different. Now, I don't think that I'm positive like all the time, but in every situation, like my children now, there's a lot going on for them at school. I always say, right, this is really bad right now. This situation is really bad. Let's try and find the positive in this. And I say it quite a lot, actually, most days, right? What's the positive for today? So I am now able to recognise the positive or try and think positively, but it's quite small, but that's enough for me. So lovely. I can find it can be quite overpowering, but it got to the point where it was so overpowering, I found myself in a negative place all the time.
And of course, if somebody like if you try and force somebody to be positive or tell them they're not good enough because they're not positive enough, then you're right, it becomes a negative. It becomes a stick to beat somebody with. Like if only you just, and that's the danger with, I think there is a danger of being too positive.
And I think because obviously of what we're talking about and being unwell, if you are surrounded by people that are overly positive and trying to inflict that on you when you are unwell, it is not helpful.
I bet it must have made you feel really alone and disconnected from them.
So
they just don't understand me.
It makes you want to not be around those people, because it's not very helpful.
Yeah, I bet it felt really judgmental. Like, just think more positive and you'll be okay. And it's not that simple. And as a psychologist, I know I meet lots of people who are very depressed who tell me they've tried really, really hard to be positive. You know, if that was the answer, if it was that simple, we wouldn't have depression in this world, would we? And
We'd all be doing it.
Yeah, it's very unvalidating when somebody's trying to tell you to be positive. If you just do this, if you just think positively, and it doesn't work like that.
No.
You have to find your own. You have to find it for yourself and what works for you.
And it sounds like what you're speaking there is what's more powerful is authentic validation of positively seeing that person for what they're feeling and what they're going through now.
Yeah.
That's much more positive than forcing somebody to be positive. What's a positive step is saying, I understand. I see the pain that you're in right now, and I'm willing to be with that and not force you to change or be different right now.
But equally, I just want to add that since I've been able to find positivity in my own way, at my own pace, it is such a good feeling after, especially when you've discussed it with, well, in my situation, my children. We all feel better after that when we can try and draw on, but what is the positive in this?
Yeah.
However small it is.
Yeah.
You do feel better. So I have managed, I'm probably pleased to say, after many years of being so negative, because the positive was too overpowering, I've been able to find my own little bits of positive. So, yeah, it isn't easy.
It's not easy.
No.
You know, it's something that's so simple, isn't it? And yet it's not easy. And I often say that simple does not mean easy. You know,
It's
some of the
powerful.
simplest things are the hardest to do, aren't they?
But it is powerful when you can feel positive or just see the little bit of positive in a given situation. It can be quite powerful, and then that leads to hope and acceptance and all of that, doesn't it? So
yeah, and they're really empowering sensations and feelings, aren't they? And if we can connect to our acceptance and our hope for the future, then that can feel really positive and help motivate us to get through each day. So on reflections about this conversation about positivity, what advice would you give to any new mums who might be experiencing anxiety, depression, going through their own mental health journey right now?
I would definitely say that your journey is your own and your recovery is your own, and the pace of that is your own, that can't be prescribed or kind of dictated by anybody else. Even from the conversations that Hayley and I have, and obviously through the work that we do with mums in the team, we know that everybody's journey is so different. And it's a bit like the comparisons we make with our children, isn't it? We compare our children to other people's children. I think our recovery journeys, maybe as an analogy, are similar. It's like it happens at our own pace, because there's so much that kind of feeds into it from lots of different places. So I guess that's the long version. The short version is you set your journey. You take ownership of it if you can, and go with your gut 100%.
Yeah, there's something about trust your instinct there, isn't there?
Yeah.
And allow it to unfold and have that faith that, you know, although this might be hard right now, there's potential growth and learning here. It's okay.
Yeah.
Thank you, Candice. What about you, Hayley? What advice would you give?
I definitely echo everything that Candice has said, so I have exactly the same views, really. But I guess for somebody that has probably lived in a negative world for so long, there's always a little bit of positivity and hope they're somewhere. So just try it at your own pace. As Candice has already said, it's got to be unique, that's right for you. So even however bad that situation is that you're going through that day, just try and find a little bit of positiveness, even if it is just, I think positiveness kind of comes with, I want to say, grateful, kind of the positive. It might even just be that you've managed to have a hot drink or something. That's still a positive step that you've been able to do that. It kind of feeds into lots of other feelings as well, but don't put pressure on yourself to be positive, to be, just be who you are and take it at your own pace, really. But just my advice would be just try and find that little bit of positiveness, because I think if I had tried longer, I would have been further along the way. It does work.
But it sounds like it's really important that you try for you. Like, don't be positive for somebody else just because they want you to be positive. Don't work like that.
No,
it's like it has to genuinely come from you, doesn't it? But like, I'm seeing all of these really interesting topics to talk about, like gratitude, acceptance, empowerment. Like, I can't wait to do some more conversations with you two about in future podcasts. But thank you so much for sharing today these really, really great ideas about positivity. And it sounds like actually the most positive thing any of us can do is accept who we are and what is happening in this moment. Let go of fighting reality. Don't force it to be positive. Thank you so much. So what I just want to say is, as we end the podcast today, if you've listening and you've been affected by anything that we've been talking about, then do remember that you're not alone. There is help available, and you can always talk to your GP, your health visitor, or your midwife, who may be able to support you or signpost you in the right direction. You can also call 111. They have expert mental health practitioners available. Or you can also visit the Southern Health website and click the Help in a Crisis link that will take you to lots of local networks and support. So thank you for listening to Southern Health Podcast, Conversations with Perinatal Psychology, because we know maternal mental health matters both for you and your children.